Good afternoon, everybody. I'll be talking about the clinical applications of anterior segment OCT. There are many anterior segment OCT systems available in the market, and each design has its own distinct advantages. Mainly, there are two types, the dedicated anterior segment OCT systems and the systems converted from retinal scanners. The dedicated anterior segment OCT systems, they use the wavelength of 1310 nanometers and provide us with deeper and wider scans. As compared to the systems converted from retinal scanners, they use the wavelength of 830 nanometers, and they have limited scan range but very high axial resolution. As you can see, this is a scan taken from Visante OCT, which is approximately 16 by 6 millimeter, as compared to the scan taken with RTVO OCT, which is approximately 6 by 2 millimeter, but the axial resolution is in the range of 3 to 5 microns. With the systems converted from retinal scanners, you need to use add-on lenses like cornea anterior module, which provide us with various scan options. With the high resolution anterior segment OCT, you can visualize almost all 5 layers of the cornea, starting from tear film, epithelium, Bowman's membrane, stroma, and Descemet's membrane and endothelium. It also gives us the detailed morphology of the anterior chamber angle. So coming on to the clinical applications of OCT, it is used for wide variety of corneal and anterior segment disorders. So I'll cover all one by one. So keratoconus can be diagnosed on anterior segment OCT based upon these 4 criteria in the central 5 millimeter pachymetry zone. This is how a normal cornea looks like on anterior segment OCT, and this is a case of keratoconus. You can see that the corneal thickness is less than 470 microns, and there's marked infratemporal to superonasal asymmetry. It also provides us with the progression pachymetry maps. Now, epithelial mapping is a newer concept to detect early cases of keratoconus, PMCD, or other types of corneal ectasia. The average corneal epithelium thickness is around 50 to 53 microns, and it's uniform throughout the cornea. But in cases of ectasia, what happens is that whenever there are abrupt changes in the stromal thickness, it is the response of the epithelium to get thickened and to level that irregularity. So if we see the overall corneal thickness, it is still the same, but the anterior segment OCT shows us that there is an epithelial thickening followed by the underlying stromal thinning. So it can pick up corneal ectasia at a much earlier stage than routine topography. Now, demarcation line is a direct clinical evidence of the cross-linking process. The depth of the demarcation line is measured as the effectivity of the procedure. ASOCT, high resolution ASOCT, also shows us the intracorneal ring segments very beautifully, and it is used to assess the position and depth of the intacs. It also allows us the visualization of the LASIK flap. So the measurement of the thickness of the LASIK flap is almost very reliable for almost whole of the extension of the flap. And it also tells us the morphology of the flap, like the flaps created with the femtosecond laser are more thinner and planar as compared to the flaps created with keratome, which are thicker and of meniscus shaped. Another application is the use in PTK planning. So whenever there is a corneal scar, we need to determine the depth of the scar to decide our management protocol. Like this is a case where you can see that this is a large central corneal scar. This is a case who presented to us post-LASIK surgery, and the surgery was done with the help of microkeratome elsewhere. The patient has had a best corrected vision of 6 by 9, but with loss of glare. So we did the anterior segment OCT to measure the depth of the scar, and the ASOCT showed that the scar thickness was almost around 186 microns, and it was involving the flap. So we decided to, and there was sufficient residual stromal bed. So we decided to proceed with the flap amputation and peeling of the scar. So this is the scan taken 1 month post-op. There is a minimal scarring left, and the patient was much more comfortable post-surgery. Now, ASOCT is also must before you consider any kind of LASIK enhancements. It can visualize flap even after years of refractive surgery. Now, this patient presented with the residual refractive error of around 1.7 diopters, and ASOCT showed that the flap thickness was around 177 microns and the residual thickness was 265 microns. So we decided to proceed with surface ablation rather than relifting the flap and doing the surgery. Now, in this patient, patient presented to us with this kind of epithelial ingrowth 2 years after the LASIK surgery. And the slit lamp examination showed the desquamated epithelial cyst with milky appearance in the periphery underneath the LASIK flap. We did the ASOCT, and ASOCT showed that the extent of the epithelial ingrowth was much broader than it appeared on the slit lamp, and there was a flap thinning in the overlying area. So OCT confirmed that this patient needed surgical intervention to remove the epithelial ingrowth. Now, for the corneal surgeon, it is also becoming an important tool to monitor the health of the DSEC graft, to know the position, attachment, quality of the interface, and corneal thickness. So this is a scan which is showing very nice attachment of the DSEC graft on day 1, along with a little bit of corneal edema. But in this particular patient, on day 1, on slit lamp, the graft was not able, we were not able to visualize the graft because of corneal edema. And then we did the anterior segment OCT, and that showed that there was a central detachment of the graft. So that was the reason of marked corneal edema. We did rebubbling on the same day, and this is the post-operative OCT scan showing very nice attachment of the graft, and there was complete resolution of the corneal edema. Similarly, it's very useful in DM detachments in the post-operative period. Almost approximately 14% of the DM detachments are picked up on OCT in the post-operative period, as corneal edema does not allow us to visualize the DM detachments. Now, the most exciting development in the refractive surgery is the development of femtosecond laser-assisted cataract surgery. And most of these systems, they have real-time OCT integrated in them. And these OCT allow us to visualize almost whole of the anterior segment, starting from cornea to posterior capsule, and also allows us to see the morphology of the corneal incisions. Like these scans show that the femto laser-assisted incisions are more like biplanar and uniform, as compared to the manual incisions, which are uniplanar, and there is endothelial misalignment and DM detachment. Now, this is one interesting case of posterior polar cataract. So we planned femtosecond laser-assisted cataract surgery, and intraoperative anterior segment OCD picked up this posterior capsular defect. So in these kind of cases, what we can do is we can increase the safety margin between the lens fragmentation and posterior capsule and safely proceed with the surgery. It is also very important to know the vault size of the ICL, which can be very accurately assessed with the help of anterior segment OCT. Vault size is the distance between the posterior capsule of the lens, distance between the posterior part of the crystal line lens and the posterior surface of the ICL. And this is the normal vault. And in this case, the vault size is around 244 microns, and the low vault predisposes the eye to cataract, and the higher vault can lead to angle crowding and glaucoma. So OCT can assess the vault size very accurately, and we can do the second surgical intervention like explantation or exchange of the ICL at very right time. There are many other applications of the anterior segment OCT, so I'll just enumerate them. Like in IOL power calculation after LASIK surgery, tear film meniscus measurements in dry eyes, lamellar keratoplasty, and in infective keratitis to assess the depth of the corneal ulcers and to monitor the response to the medical therapy. And it is also useful to assess the anterior segment tumors to visualize and monitor the growth. So OCT is applicable to assess a wide variety of corneal and anterior segment conditions, and it's the indication or applications continue to evolve, and the future advancements promise us many more clinical and diagnostic applications. Thank you.